everyone, I'm Crisha Maria Pelga from SAS in Iloilo, Batch 3. For today, I'm going to perform oral care for unconscious patient. Mouth care is defined as the scientific care of the teeth and the mouth. Number one purpose is to keep the mucosa clean, soft, moist, and intact. Number two is to keep the lips clean, soft, moist, and intact. 3. To prevent oral infection. 4. To remove food debris as well as dental plaque without damaging the gum. 5. To alleviate pain, discomfort, and enhance oral intake with appetite. 6. To prevent halitosis or relieve it and freshen the mouth. But before I start, I will check the client's identification and condition first. Then, explain the purpose and procedure to the client. Next, you're going to wash your hands, apply gloves before beginning skills. For these skills, you'll need a waterproof barrier for your work surface, a towel, an emesis basin, mouthwash solution, 2 cups, 3 oral swabs, a padded tongue blade, and a lip balm. For preparing equipments, collect all required equipments and bring the articles to the bedside. Prepare sodium bicarbonate solution in galley pot. If the client is unconscious, use plain tap water. Soak the cotton ball in sodium bicarbonate solution or 3 pinches or 2/3 water in galley pot with artery forceps. To reduce potential infection, cleaning solutions aid in removing residue on the client's teeth and softening encrusted areas. Squeeze all cotton balls excess solution by artery forceps and dissecting forceps and put into another galley pot to avoid inspiration of the solution. Then we have to close the windows and door. It maintains the client's privacy. My unconscious patient is already positioned on her side with a pillow behind her back. Good day, Mrs. Cruz. I'm Crisha, your caregiver for today, and I am here to do your oral care. Now I'm going to put head of the bed up a little bit. And I'm going to get things positioned. I'm going to put a towel under your face in case there's a drainage. Next is I will take the emesis basin and place it near her chin and under her mouth and to help collect anything that drains out of her mouth. I will start the oral care by using a solution of 1 part mouthwash to 3 parts of water. I take the first oral swab and get it wet with mouthwash solution. I will use the oral swab to clean the outside of her teeth and inside of her cheeks, always making sure to keep the oral swab in her mouth once I've cleansed the outside of her teeth and cheeks. I place the oral swab in the basin and I will use my padded tongue blade to place it. And I will use my padded tongue blade to place it between her teeth and hold her mouth open if her mouth is not open on its own. I'll then obtain the next oral swab with mouthwash solution and use it to clean the inside of her teeth, the tongue, and the roof of the mouth. I will use my last mouth swab with water and I will wipe around the entire mouth to help rinse the excess mouthwash off. Then I will remove the emesis basin and use the towel to dry her face. The last step will be to apply lip balm. As long as my patient is not on oxygen, we don't use petroleum-based products with oxygen, as oxygen is combustible. Next, I will clean up my supplies and remove the towel. And I will make sure that I put the head of the bed back down to 30 degrees and place the call light in reach of Mrs. Cruz. I'll clean up my supplies, take off my gloves, wash my hands, record, and report.